Hi, my colleagues. Um, my name is WMoise. I go by Walk. I am a working professional. I'm a respiratory therapist. I've been working in the field for more than 3 years now. I started graduated in 2020, right in the middle of COVID. I am glad that I was a part of COVID. I was a part of the team that really care for the COVID patients. And I have to say that I've learned so much during the COVID time. It was a tragic moment and the time on the field of respiratory care, which I have seen so much and I have learned so much during that time as well. I believe this field is a great field, and there are a lot of things that we can contribute in the care of the patient in the hospitals. I believe professionally, some of the challenge that I may have is when we have some patient that come in. It could be in the emergency room. As the bedside therapist said, it could be challenge could come with the patients that really don't you simply don't want their breathing treatment. Where sometimes it could come from the doctor where a patient maybe if you work in the emergency room, a patient may be coming for exacerbation or asthmatic, where the intubation may not be the first this may not be the first thing to do, but some doctor really want to do that, and it is might be hard, but I find myself usually advocate for this patient not to get them intubated. And just recently, I was in the emergency room. I advocate for one patient. I really advocate really hard, and later on, the patient I was able to place the patient on the BiPAP, and later on resolve. And the doctor said, it was a good call, but. This is what I do. I work in the field. I've seen this multiple times. It really reverse and protecting and will avoid what we call intubation for the patient that may outcome might not be great. Um, this is professionally. This is one of the things that I find very difficult. Um, and also professionally, I have grown so much since the time I enter the bachelor school at Boise University. My experience were from different courses that I learned. It helps me be a better therapist. It helps me to improve my communication um, between the discipline between the colleagues, whether the doctor or the nurses. My communication with them for the out care of the patient have been grown and professionally, and I really present myself as a therapist, bedside therapist, and what I am saying, I'm making sure that what I'm saying is valuable to the care of the patient. So my philosophy is the outcome if the patient is greater than whatever we may say or think. But what we are saying must be a proper thing that will help the care of the patient, especially if you are a part of a emergency medical team. Really, it could be a simple supplemented oxygen. If I feel like this is the right thing, I'm going to say this is one of the things that I recommend that always for the purpose for the good outcome of the patient. I feel one thing I feel like I learned doing this that I've grown professionally since I started this bachelor degree. It helps me on my communication. It helps me to present myself as a therapist, and this bachelor level preparing me for the best. And I believe this will help me further on my education and hopefully graduating and hopefully going beyond of my bachelor degree. And it was a pleasure to meet all of you. And thank you so much for this time. And good luck to all of you. God bless.